Welcome. I'm Dr. Wee Youssef, Professor of Public Service at Old Dominion University and Assistant Director with ODU's Institute for Coastal Adaptation and Resilience. In my portion of this discussion, I want to briefly highlight three key issues regarding public policy and management responses to a pandemic threat. My discussion is based on stakeholder conversations held with emergency management, public health, and related professionals at the onset of the 2020 Atlantic hurricane season. Over the course of 6 conversations on a variety of topics related to preparedness and response to the then upcoming hurricane season in the midst of the COVID-19 pandemic, we engaged with over 260 government, nonprofit, and community representatives and researchers representing functions in the areas of emergency management, public health, communication, transportation, health services, and others. The first issue I want to talk about is how residents will respond to the duality of issues associated with the pandemic and a hurricane. With a compound event, emergency managers and related professionals must address the needs and issues associated with emergencies. This can be challenging not only if they are at different phases of the emergency management cycle, so for example, response versus preparedness, but also if they require policies and practices that are at odds. As of May 2020, communities across the U.S. were in the midst of responding to COVID-19. Simultaneously, the National Weather Service's Climate Prediction Center forecasted an above normal 2020 Atlantic hurricane season, prompting coastal communities to undertake preparedness efforts and plan for how they would respond to a hurricane. In the absence of effective treatment or a vaccine, governmental response to COVID-19 in the U.S. had relied heavily on behavioral restrictions associated with social distancing, including business restrictions and stay-at-home orders. In contrast, the threat of a hurricane may prompt evacuation orders that require residents to leave their homes to reduce their exposure to risks of the hurricane. With the compound hurricane pandemic threat, emergency managers and decision makers must balance evacuation and the removal of people from the areas at risk of flooding, storm surge, and wind damage with the social distancing needs of the pandemic and the stay-at-home orders that most residents had been complying for weeks, if not months. While the evacuation versus shelter-in-place decision hinges primarily on technical decision criteria, such as forecasted impacts of the hurricane and availability of transportation and shelters, emergency managers and decision makers also needed to consider behavioral responses of residents, and more specifically, how will the public respond? Particularly relevant in the case of the hurricane pandemic was the question, how will the public react to an evacuation order when they have been sheltering in place for an extended period of time due to COVID-19? The second issue has to do with planning for and meeting the needs of changing vulnerable populations. Some residents are especially susceptible to different hazards, and these vulnerable groups require preparedness, response, and recovery. The elderly and medically fragile are more vulnerable to hurricanes, requiring special considerations for evacuations and sheltering, but COVID-19 imposed additional constraints on these populations that were also more vulnerable during the pandemic. The economic impacts of COVID-19 also rendered a wider swath of the population vulnerable to a hurricane, as more residents may lack financial resources to evacuate during a hurricane event. And finally, resource constraints. The prolonged nature of the pandemic, which required response over a long period of time, necessitated that government and nonprofit organizations maintain normal operations, with some accommodation due to the pandemic, while also providing sustained pandemic response. Staff and operational resources are strained by an extended pandemic. Additional resources need to be extended, such as for extra cleaning or for protective equipment. Furthermore, the pandemic may negatively affect the resource base of governments and nonprofit organizations, such as through lower tax collections or reduced philanthropic donations. In addition to resources needed for normal operations and pandemic response, and a negative impact on resource availability to a pandemic, hurricane preparedness and response activities during a pandemic will require additional resources. Furthermore, the economic impacts of a pandemic are also borne by residents who may experience reduced work hours, loss of wages, and additional costs to protect against the pandemic. The result is a reduced capacity or ability to prepare or to evacuate during a hurricane.